Bionics stent study was a more common study. It was a pre-CE mark and pre-FDA study that was run by the Medinol company in a more common population. More common population means that are not the patients that normally are included in this kind of study, but are also more complex patient comorbidities and lesion subset. So they were included the multivessel disease, they were included saphenous vein graft, they were included CTO. And this was, as I said, quite brave on my side, because normally when we do this kind of study, the population is much more selected. So this was a large population of more comers, and the randomization again was EluNIR versus the Resolute stent, and the endpoint was a clinical endpoint because of the large sample size. It was 1 year target lesion failure, and the primary endpoint was met because the EluNIR was non-inferior as compared with the Resolute at 1 year. The TLF rate was almost 5% in both groups. So the 2-year results just demonstrate that there was not late catch-up phenomenon, at least up to 2 years, and still there is the non-inferiority of EluNIR as compared with the Resolute stent, and the TLF at this time is around 7%. We were talking about the primary endpoint, and which is the efficacy of the device, but we were not touching another point that I think was very interesting regarding the stent thrombosis, because up to 2 years there was clearly the study is not designed to define any significant difference in stent thrombosis. You should have much more big study population, but there was a 0.5 in favor of EluNIR as compared with 1%, not statistical significant, but when you do the landmark analysis and you just consider the thrombosis that were late and very late, you had a 0.10, which is a statistical trend. Clearly, as a clinician, we have to take care of that. We cannot say that this platform, this stent is safer than others, but it is a good signal because it means that at least this is not only an effective device, but it's also a safe device. So from take-home message, we can say that this new generation drug eluting stent, because of its own characteristics, demonstrated to be non-inferior in what was the primary endpoint as compared with the state-of-art drug eluting stent, such as Resolute. Also, the safety was confirmed, and we had an interesting statistical trend, even if the study was not powered for that, in favor of EluNIR on late stent thrombosis. We were quite lucky to test the device while in the clinical trials. The commercial device, I have to see, is improvement of the prior version. What I found in the commercial device is that deliverability is a key component of this kind of platform and of their delivery system, because their intrinsic characteristics. We wanted to test the commercially available device in a complex lesion scenario where we would have think to have problem in deliverability. So in our commercial experience, it's a very limited experience, we have to say, but we selected cases of patients where we understood from the beginning that we could have a potential problem on deliverability. And I have to say that this very tortuous and calcified vessel, sometimes with poor support of the guiding catheter, the EluNIR stent performs very well and was delivered in the lesion.